Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. Concerns are rising over how a federal quality measure may be limiting access to needed treatment for millions of nursing home residents. A new report from Manatt Health says CMS's long-stay antipsychotic medication QM, originally designed to prevent inappropriate antipsychotic use, has had unintended and harmful consequences. The metric, which became part of the Nursing Home Care Compare 5-star system in 2012, tracks how many long-stay residents receive antipsychotic medications. Authors argue the measure oversimplifies a highly complex clinical decision, noting that antipsychotics can be appropriate and effective after non-pharmacological options are exhausted, and decisions require individualized assessment. According to the report, the measure applies a one-size-fits-all approach for pressuring nursing facilities to reduce antipsychotic use across the board, even when not clinically appropriate. It fails to distinguish appropriate from inappropriate prescribing, doesn't align with current clinical guidelines, and may have actually increased the use of substitute medications such as anticonvulsants, antidepressants, anxiolytics, and even opioids. The report also raises concerns about inaccurate diagnostic coding, inadequate exclusion criteria, and lack of meaningful context for families trying to interpret the 5-star system. A new federal quality data for SNFs brings significant changes, including the first-ever public reporting of 2 new transition of health measures. Metrics tracking reliability that nursing homes provide a reconciled medication list when a resident's transferred to another provider or discharges home. Details CMS says are essential to preventing complications, readmissions, and medication errors. Many facilities may actually see a boost. The national average completion rate already exceeds 95%, with some limitations. Facilities with fewer than 20 qualifying cases will display not available on Care Compare, and CMS stresses this medication reconciliation process is different from the pharmacist review, drug regimen review that's routine and required under federal regulation. Industry experts are urging facilities to audit transition and discharge workflows, warning inconsistencies will be highly visible in the new scores. CMS is deliberately pushing transparency around care planning gaps, and also new in this data refresh, public reporting of the percentage of residents who are up to date on COVID vaccinations, as CMS's not aligned criteria with recent CDC changes, leaving facilities to rely on clinical judgment until further guidance is issued. Nationally, average score for this measure is 24%, a steep drop from 80% seen earlier in the vaccine rollout. Meanwhile, providers must remember failure to submit at least 90% of the required QRP data carries a 2% Medicare payment reduction. With care transition and communication and vaccination processes now front and center, the newest data refresh underscores CMS's ongoing focus, transparency, coordination, and accountability in skilled nursing care. A new study headed for publication in the Journal of Post-Acute and Long-Term Care Medical Associations, raising questions about how states license AL communities and what that means for older, low-income adults relying on Medicaid. Researchers say state licensing policies play a critical role in determining whether Medicaid can actually be used to pay for AL services. And that matters because older adults who receive home and community-based services in AL experience fewer adverse health events than those receiving the same services living independently. Recent federal legislation substantially reduces federal Medicaid funding, limiting the state's abilities to maintain Medicaid-covered AL programs and remain vulnerable to state and federal budget cuts. Analyzing 2019 data from nearly 33,000 licensed AL communities nationwide, 89% of communities had a license type allowing them to accept Medicaid. Yet only 44% were Medicaid certified, meaning most communities that could accept Medicaid simply didn't have a contract in place. And Alabama, Kentucky, Louisiana, Virginia, and West Virginia had no Medicaid reimbursed AL in 2019 at all. Researchers say the gap highlights the need for states to better align licensure rules with Medicaid payment policies, ensuring affordability, access for vulnerable adults, calling for research on why eligible AL providers choose not to accept Medicaid and how this ultimately affects residents' access and health outcomes. Thank you for joining me for News This Week in Nursing Homes. To get more of Qsource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your QI needs, call the Q.